Hello again, everyone. Edwin Learnard back once again. In this YouTube astrological segment, I'm going to be talking about medical astrology and the asteroid Juno. Well, first off, as far as like by the body parts and health related matters that can be connected with Juno, first off is it can be associated with that pelvic area of the genitals of female. Also pregnancy, trying to conceive, conception. It could also be about what one can be married to as well, like what can be an indelible fixture. I mean, let's say, for example, if you have this in the first or the sixth house in your natal chart, you might be married in some cases to some physical related issue. The sixth house, of course, is associated with physical health. The first house is the physical body. Could also be on a positive end. If you have this, like say in Sagittarius, you can have that. You might be somewhat married to maybe something as far as sports go or exercising, athletics, which could actually promote health. It could be working out vigorously. You may, and if you have this again, going back to say if you have Juno in the first or the sixth house, there could be some health related issue associated with the sign Juno is in. That could be, you might feel it's like an indelible fixture to you. Like say if you have it in Capricorn, it could be some issue with the knees, the bones, the joints, the hamstrings. If it's in Aquarius, it may be something like something with the ankles, the shins, the circulation. Something with the calves, the lower legs, some nerve related issue. Now, like my case, for example, I mean, looking at the sign it's in, may give some indication. I mean, remember that this is also the marriage partner, so it could reflect some issues that the marriage partner may have. Now, let's say, I mean, let's take my example. I have Juno in Aries in the 12th house in my natal chart. Now, the fact it's in the 12th house of mental illness, it's possible if I ever do get that significant other, it might be somebody with some limitation or some restriction. It could be a mental disorder, it could be some angry type mental illness, something like intermittent explosive disorder or whatever. There's any other, I'm sure there's other mental illnesses that are associated with anger. It could be somebody that just has some general limitation. This could be, and also, I mean, somebody that might have some issue. I mean, you're talking about Aries, something with the head or the face, anything that could be related with the zodiac sign Aries. Now, or also, you're talking about the eyes, perhaps. Now, another thing too is that when you look at Juno in a chart, look at the aspects it makes. 2 points in the chart is that could, of course, impact the delineation and interpretation. Now, remember, keep in mind that Juno can reflect that marriage partner in one's life. So, as far as I go, going to the fact that this could reflect the marriage partner, my Juno makes at least a loose inconjunct aspect to my natal Neptune. And when you're talking about inconjuncts in astrology, they can be about health related issues. So this could also be somebody that a significant other might be drawn to somebody, sadly, maybe might be involved in some kind of drugs or some alcohol, or some other addiction. Now, the thing about this is now, say if Juno is afflicted in a female's chart, there might be greater propensity for problems that are related to conception, to getting pregnant. It could also be Juno can also be connected with dealing with emotional or physical harm from that marriage partner. And the thing is, if your Juno is afflicted, especially female, as far as a female goes, the physical element is going to be stronger because it's related to conception and pregnancy. But you could be a male and you could still, I mean, be involved in physical harm from the spouse, even though it's usually the male. Of course, that's inflicting the harm on the female, but it doesn't mean it can't go the other way in certain instances. Now, let's say, for example, you have Venus making an adverse aspect to your Juno in your natal chart. This could be, in some cases, may manifest in some, for example, some gestational diabetes in the time of pregnancy, because remember that you're talking about um, Venus can be, Venus rules over Libra. It can be associated with something of a, diabetes, and Juno is associated with pregnancy. Now, let's take another example. Let's say that Juno in a female's chart may, if it makes an adverse aspect to their natal Saturn, well, this may manifest in some kind of delay in terms of having a child, or say that their Juno is retrograde. That's how it could work out as well. It might be some delays in getting some kind of conception, or getting pregnant. There might be also too, transits also are important to look at that involve Juno, because that could play a role in physical debilitations that are related to the asteroid. Now, let's say, for example, somebody has transit Mars, making an adverse aspect to their natal Juno, even a conjunction to their natal Juno. This could result in some cases of dealing with more abuse by a marriage partner. It could be, in some cases, it might be some kind of, you're talking about Mars, it's just it could be pain for the female in that, you call it the private sector, the genital region. Now, another thing too is that looking at this as well, you're talking about also aspects. You're looking at another example. Aspects in a progressed chart can also manifest or indicate physical related matters associated with Juno. Let's say, for example, if you have Juno in the progressed chart, you have Juno making an inconjunct aspect to the ascendant. Let's say it's from the 6th house. So this could really give greater propensity to feeling like you're married to some kind of illness that can be associated with the sign that Juno is in. Again, like I stated before, it's safe. It's Capricorn. It could be something with the knees, the bones, the joints, the hamstrings. If it's in Sagittarius, it could be something with the hip, the liver, the thighs, something with the sciatic nerve. And the thing about this too, let's say, and that of course could also apply if this is a situation where it's in a transit, or you have that aspect natally. Now, if somebody has another example I want to talk about as far as an aspect and some possible physical situation one may have. Let's say, for example, somebody has a female has Venus making an adverse aspect to Juno in their chart, and whether this is by transit, progression, or natal placement, this could be somebody at this time I have some kind of greater proclivity toward getting some kind of sexually transmitted infection to the genital area, because Venus is associated with sexually transmitted diseases, and of course Juno can be associated with the female genital area. So those are some ways that this could manifest and pan out as far as issues that are associated, physical related matters that are associated with the asteroid Juno. So anyway, people, that'll conclude this YouTube astrological segment. Until next time, people, Edwin Learnard saying stay well.